I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. Another day means another fear-mongering medical article in the news. These medical arteries cause so much confusion in average people, and even well-educated professionals, including doctors, have a difficult time trying to figure out what the published article says or what the, quote, magazine medical article really says. So today I want to make some generalizations about what you read and what it means, and hopefully it'll help you decipher what is true and what isn't true. So the first thing, any study or conclusion from work in mice, or what we call ex vivo, which means done in cells or tissues outside of the body, a preclinical study basically, is meaningless. You can say to yourself, wow, that's interesting. But other than that, don't think that that's a drug that's going to treat a type of cancer in mice will be applicable to human beings. More likely than not, it will never be studied or tested in human beings. And if it does, possibly more than a decade will pass before any conclusions can be drawn. 2, and most important, when something says association, that does not mean causality. Remember that. 3, beware of anything not published in a peer-reviewed journal. There's hundreds of journals that are industry-sponsored, quote, magazines that look great and would be delighted to publish anything, often for money. However, remember that even the best journals have to retract articles after occasionally finding out the data was manipulated or fraudulent. 4, be skeptical of a study done in a third world country at a single medical center, something that's published in some journal that has a fancy name but is really difficult to find or is not translated into English. 5, the gold standard is always a randomized controlled trial, or RCT. Granted, there are some studies that just can't be done or will never be done as a randomized controlled trial. There are many reasons for this. Cost or logistics are 2 possibilities. Also, you really can't do a randomized controlled trial when one group will be denied a life-saving drug or a proven cancer drug while the other group does not get it. For example, let's say there's a group of patients who are at risk for a second heart attack. Drug A is a cholesterol-lowering medicine that is proven to reduce cardiovascular events for the second time, and it is used now as the, quote, standard of care. Now there's a new drug, drug B, that has shown great results in lowering cholesterol, but there's no data that it'll show it will reduce second heart attacks. This will not be done, a study like this comparing these 2 types of drugs. It's simply not ethical to deny one group of patients a drug which works and may prolong their life, and then a study that hasn't been shown anything other than lowering cholesterol. It would have to be constructed differently to ensure that both groups get potentially life-saving drug A, and then drug B could be used in one group and not the other. This is just an example. 6, a retrospective study is generally meaningless. Let me tell you how it's done in the real world. Prior to electronic medical records, some doctor or researcher needs to add something to their curriculum vitae, which is known as a resume. So then they figure out how they're going to get cheap labor. And we have medical students and residents. We have them scour the records department and look for charts. And they were assigned to find a word, a keyword, or a thought. Then they collect the data, and a statistician plays with the data, and a paper is generated. How do I know this, you may ask? Because I was a medical student once and a resident. And I can assure you, when you see the word consecutive in reference to reviewing the charts of 100 consecutive patients, for example, that's a lie. If the chart was too large or the information wasn't easily found, it was just skipped and tossed into a pile. Now with electronic medical records, it's easier to collect info, but the same routine is followed without having to use paper. I was jokingly told by a professor once that an expert is somebody who has a big briefcase with a lot of slides. Sadly, this is often true. The guy who's operating doesn't have time to write these kind of papers. 6, Look closely who sponsored or paid for the study. 7. If something is not published in a journal, it's just a news story. It is just that, a story. So with that, I hope now you have a basic foundation when you're looking at a story sent to you by a friend or an article by a friend, and it never says the title or it never says the journal and it just says a story, dismiss it. But if it says more, like the journal or the authors, you can go to PubMed and you can look it up and you can see the true story, because often the true story is not what was written. So with that, I hope you learned something tonight. I hope this makes you a little bit smarter, and I appreciate you listening. And for more information, you can go to my website at www.paladinmds.com. And again, thank you for listening.